Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. How many of you sitting out there think you are disabled in some way? Sometimes it can be eyesight, it can be muscle movement, it can be all kinds of so-called disabilities. Well, today we're going to disability. This is a word that comes into our vocabulary now, dis. When somebody dissed you, and that means they get rid of you in a way. Well, we're going to disability because we're going to talk to someone today that has actually disability. A person that's been at Downstate Medical Center, but before I even get into her, what she's all about here, but I saw her riding around in a cart at Downstate Medical Center, and I didn't know too much about Maple, but I introduced myself to her, and she was so pleasant. She was being an administrator, doing something in the hall with some other students and things like that, and talking like she had complete command of all the things that were happening around her. So I knew that she wasn't disabled. A beautiful smile, very quiet speaking, and not overbearing on students and things like this, and they had a lot of respect for her also. So today we want to get into a little bit about disability, and maybe you sitting out there who think you're at the end of a rope, it might be just the beginning of climbing up that rope rather than to letting the rope down. So I want to introduce you to Mabel Monty, who's been here so many years. I've seen her down the hall and so forth. And maybe just get a little background on you, how you got to Downstate here, doing your job in occupational therapy. But maybe just start off just how you maybe got your injury and what brought you into a so-called electronic movement to assist you rather than to be your total movement.
Sure. I actually sustained a motor vehicle accident back in 1985 in the state of Florida.
Okay.
I was visiting there with my brother, and I shattered the cervical vertebrae, cervical 3.
I see.
No, cervical 5, I'm sorry.
Mm-hmm.
And so I ended up sustaining a partial lesion to my spinal cord.
Right.
And so I was hospitalized for a total period of 7 months,
mm-hmm.
undergoing both the acute aspect of treatment for my spinal cord injury and the rehabilitation in the state of Florida. And
how old were you then?
I was 25 then.
25. Mm-hmm.
I was 25 then. And then I received so many services. I received recreational therapy, occupational therapy, physical therapy. And it was actually the first time that my eyes were open to this kind of therapy. I never even knew it existed.
Right.
I never even recall, if I can recall back, I don't recall seeing as many disabled people in New York City, unless you were a geriatric person and maybe you needed to use a wheelchair. But in that entire experience, I think that what I came out of there was that when I came back to New York, that I was going to do something maybe different.
Okay.
I was already trained as an aerobic instructor. I had already acquired an associate's degree in marketing management and sales, but I just knew deep in my heart that I was wanting to do something different.
Right.
And so when I came back to New York, I continued my outpatient therapy for physical therapy and occupational therapy.
Uh-huh.
And in doing so, my occupational therapist was a graduate from Downstate.
Oh.
And I asked her lots of questions about occupational therapy. And it just seemed to be the kind of profession that you treat the whole person.
Yes.
You just don't treat the hands, the legs, but you also are interested in how the person's activities and interests and their roles prior to the injury, what they were doing, and how the injury perhaps has either kind of been now a dysfunction for them. So, but how can they actually go back to doing some of those things, whether it's adaptive, using adaptive equipment, or just another way of doing it. So I decided to inquire about occupational therapy, and she told me a lot about the school program, and I called Downstate, went to an open house, and actually knew that if I really wanted to pursue occupational therapy, I'd have to go and change my major. So I did. I went to Kingsborough Community College.
Kingsborough Community College. So up to that point, you didn't have a college education.
I did.
You
I had an associate's degree in marketing management and sales.
I see. Okay.
But this would be a total change.
Change, right.
And so I went to Kingsborough just to take the prerequisites for occupational therapy.
Oh, right.
Then I entered the school here part-time.
Oh.
I came in 1988,
Mm-hmm.
and I came part-time during the whole time until I graduated in 1992.
From 88 to 92.
Yes.
And
Part-time.
were you wheelchair?
I was using a walker.
A walker.
No, actually, when I first came to the school, I wasn't using a walker. I was actually ambulating with a cane.
I see.
There was a professor of occupational therapy who had sustained a motorcycle accident, and she was using a walker.
I see.
And I began to have more frequent falls.
Right.
So she recommended that perhaps I use a mobile walker.
Oh, I see.
So I did. So I carried my books.
Wow.
Using the walker. And then it was like around the winter time when it was really harder to get around.
Sure.
So I actually ended up getting a motorized scooter.
Wow.
And it's been a blessing just to have all the adaptive equipment, whatever works for you to get you around.
Right.
It's fine. So
What kind of, when the accident happened, what type of family support or friend support did you receive? Or what? And was it a major point of your recovery?
it was a major point in my recovery. I actually had only one brother in Florida.
I see.
He was in the military, so it was hard for him to come to see me. We were like 3 hours away from where he was stationed. But my high school friends that I grew up with, they came, they took vacation, they came to see me.
In
at the time.
In Florida?
Yes.
From where, New York?
From New York.
Wow.
I had my family came. I had a boyfriend at the time. He came, so he would come every month to see me, and it was just the support. And I also got the support before the accident. I was going to be employed as an aerobic instructor.
Wow.
And when I didn't show up for work because they didn't know that I was in a car accident, they actually came to visit me. They were Christians, and they came to visit me frequently. They gave me a lot of spiritual support as well.
Well, that is great. And you know, I think the audience looking at our show today have to realize that it's not just the person getting motivated, but they need stimulation from all the things that you just said: family, friends, giving up their time to lift you up.
Yes.
You know what I mean? Because a lot of times we're forgotten when people think we're injured. They think that you're not to go on, but here now you were going to college and all these other things, changing your whole major. What college did you go to with the management part of your life?
I went to New York City Technical College.
I see.
And I was working Wall Street at the time, so I did that.
So you had graduated from there,
yes,
New York, and then you did what after you graduated from the New York State?
What I did was when I graduated from New York City Technical College, I was working on Wall Street. So I was going to school in the evening, so I earned my degree while I was going to school in the evening. So I was still working on Wall Street.
That's before your
injury.
injury.
Then before the injury, yes.
Right. So you were really preparing yourself for a wonderful career in management and things like that. And all of a sudden, something happens where you change completely around to say, I have to change. Leave that behind. But you didn't leave that behind either, did you?
No, I always liked sports. So there was always an interest in sports. And
did you play sports?
I actually played lots of sports when I was growing up, yes.
What kind of sports?
Softball. I was in a softball league. We played basketball. We were a cheerleader.
Right, right. So so here you are now, after having all that career, going to college and enjoying sports and things like this and so forth. Here you are so-called disabled in some way. And now it was climbing that rope of getting disability. How did you manage that in your mind, though? Was there depression ever, or did you need any psychiatric care or any from psychologists?
On the contrary, what was interesting was that when I was in Florida, I kind of in the actual I was transferred over to an acute care unit, and I really didn't know what that meant because I just was not able to move. I was wearing a halo brace, and I remember just having this whole spiritual experience where where I thought that where just like vision, a vision of a person in the rehab room, and I actually got up out of the wheelchair and walked towards this vision. And the words that I heard was, "Do not fear, have faith." So I thought that that was something that really happened.
Yes.
So that when I actually awoke, I was in my my room in the acute care unit. And so I shared that experience with my physical therapist. I shared that experience with my nurse, and they said nobody was in the room, but I held on to that. And then when I was actually visited the next day by my physical therapist, she wanted to try something to kind of stimulate the muscles, and she thought she saw the legs move.
Oh, wow.
Which I couldn't see, but she said she went to get another therapist to verify that. And so when the legs didn't move, the next day she came to my room way early in the morning, and she said, "I know that if you think that you can make your legs move, I know that you can try, because I saw your legs move the day before."
Right.
And it was the first time that they actually sat me up in the bed.
Right.
And I looked at my legs, and there was like very weak muscle mass in that. But I said, you know, if there is anything that could actually make my legs move, I just thought about the dream.
Yes.
And I said, maybe God can actually make my legs move. So when I actually looked at my legs, I actually, she wanted me to kind of rotate the legs, and I tried that, and it actually moved, which startled me because I didn't know what movement was. And then I said, well, you know, my little toes, there's only one thing I could do with this right little toe and my foot, and I could actually go like this. So I said, if I could actually do that, then I just, to myself, I was kind of challenging God. And it actually did happen. So it was like the beginning of how do you call it, recovery. Because the very next day they actually transferred me to rehab, and I was actually making small recovery.
Yes.
And at the end of May 31st, I was actually learning to walk for the first time at the parallel bars.
Well, you know, like in football injuries, basketball injuries. Recently, I have a young man in my church who was in a group of youngsters, and somebody drive-by shooting shot him in the back. And he was a scholar in school. He was a soccer player and all of this, and only 17, and he's ready to graduate and so forth. And he goes to my church, and he lived with his grandparents and parents, and they have such hope that he will get out of that wheelchair. But just the mere fact that you just said, the power of the mind is, if it's not developed as you go along in life sometime, with determinations and things like that, you can't get that sometime, you know, because it's not a passive thing, it's an action thing where you have to become part of it rather than to say, I'll pray for you. But just like Christ said, and more or less when somebody touches his garment, you're healed, there was, or the person was lame, they had to feel that they could get up and walk, you know, and they got up and walked. So these things happen in our lives, and so in doing this kind of thing, here you are now, occupational therapist, after having one career, getting injured, and then going on to get another career, studying, traveling in the wintertime. People have no idea what it is to travel just in snow. I had a wonderful person on here, Danny Dixon. He travels only on buses that have lifts, and he goes all over the. I just got him an apartment with wheelchair accessibility in Manhattan, you know, and he is like a new man, but he still travels on public transportation to New York City.
That's it. Nothing should stop him.
No. And so, but basically, after you got into occupational therapy, well, even before that, did anybody introduce you to occupational therapy, or did you just decide, or you had seen the field and you just wanted to get into it?
I saw it as something that would really treat the whole person, and I saw that they had actually introduced me to adaptive equipment. They had actually were concerned about that when I would go back home, how would I actually be able to get around in my apartment? How would I be able to get into the tub, out of the tub? So it wasn't just you work with the patient while they're in the hospital. You're also concerned about their environment outside of the hospital. You're also wanting to make sure that they can get around in the community. So that was the kind of interest that I thought. I said, you know what, they actually kind of rehabilitated me in a way that they were concerned about my environment and how would I get around, what things I would, would I still be interested in the sports and things like that. Yes. So that was the kind of career that I thought that I would pursue.
Oh, that's wonderful. And my nephew, as I told you, was also shot by drive-by shooting and lost his use of his legs. And he wound up finishing high school, going to college, way out in Ohio, and went on to play basketball in the wheelchairs league, the actual league. He belonged to a team and traveled all over the place. In fact, he was given a chance to do $1 million shot from the half-court basketball, and he was all set to go, but they wouldn't let him lock his chair.
Oh.
They said, if you're going to do this $1 million, you can't lock your chair. Your chair has to be. And so he just missed it by an inch,
Wow.
the $1 million shot, But that didn't discourage him because he went on and got his college degree and became now an instructor in athletics and everything like that, out of wheelchairs. Wonderful. And things like this, So your whole life, you're right, what I'm talking about right now. Now, getting down to downstate, how did you get a job in downstate? Now, when they saw you and you got your degree, they must have taken all kind of things in consideration of you teaching.
Well, in my senior year, there was a scholarship, and so I applied for the scholarship. It was either for physical rehab, or it was in the Department of Rehabilitation, or it was in the Department of Psychiatry.
Right.
So we had to interview, write an essay, and I was accepted for the Department of Psychiatry. So I did both my level 2 fieldwork in internship there, 10-week work study, and then once I completed that, there was an opening for a job, and I was hired, and I've remained at Downstate since. I've been working in psychiatry now 18 years. Wow. I love it. I have a passion for mental health.
Right, yes.
And now I'm pursuing my master's degree in mental health counseling.
Mental health, isn't that wonderful? Well, I tell you, I can only tell you from your face alone to get people to help whatever you're going to do, because in psychiatry, people study your face. In my office, I've oftentimes had, while I was writing, the person who I was talking to, they might be looking away, then when I was writing, they'd be looking at my face. I was telling medical students that William Osler said that no one should ever tell by your face that something disastrous has happened. Every little grimace you make in your face, and unfortunately, we don't teach the medical students that kind of thing. You're in a bed, and they have 6 students around, and they say, well, palpate this, and they say, wow, or different terms, and they don't know how that affects the patient just laying there.
Sure.
They're looking at your face, your body movement, your eyes, and things like this. I have a whole book on the face, where this woman, Miss Little, studied faces, and everything from the shape of your nose to how it's pointed or flat, whether you have full lips or thin lips, all of this has character. Adds character to your whole face.
Sure.
And people read this kind of thing. In fact, I was looking at Michael Jackson, how he had changed his whole face from what I saw when he was active as a youngster to what he ultimately, when he died. He had changed his whole face. But the face he had changed was nothing what the Michael Jackson was.
Right.
Because he had a bottom full lip, which meant very generous. His lip became very thin. And things like this. So the face is such an important thing also in the kind of work you were doing, in counseling and things like that. And I can imagine you with patients, they're looking not at your whole body, but they're looking at your face too, which gives them that, whether they're going to be encouraged or discouraged or what have you. Speaking so softly as you do, that has an effect too. Voice has such an effect. We think that we can't change it. Seems like everybody has a voice print. Have you ever always spoken softly like you speak?
I think I have. I think I have. I have a twin sister, so she tells me she's much more boisterous. But she says, God's given me boldness and God's given you quietness. But yeah, I think I'm pretty much soft-spoken, yes.
So you have a twin sister.
I have an identical twin.
Wow. And where is she at now?
She's actually unemployed, but she's doing a lot of community work. She
I
does
see.
English as a second language. She volunteers as a chaplain.
Oh. Now, do you see her often?
Yes, I do.
I imagine during your injury, she played a major role.
She did. She was actually affected by it. She said she kind of experienced some kind of, knowing that something had happened that day that the accident occurred, she just didn't feel right. And then when she got the news, she knew that something had happened. And so she's been a great support.
Right, right.
She helps me. I tell her when I get my degree, she's going to be part of she has to get part of the degree herself. She helps me to type my papers and
that's nice.
Yeah, she's quite supportive,
What do you see for the future now? How long do you think it'd be? Another 18 years at Downstate?
Well, I'm hoping that one of the things that made me realize what I wanted to do in terms of getting my master's, I'd like to continue my PhD and take either a PsyD or in clinical psychology. I'd like to be able to open up a private practice, like a wellness program, and integrate occupational therapy, counseling, and I would like to be able to meet the needs of not just the consumer of mental health needs, but also the family members.
Yeah.
So I really feel you need to kind of treat both,
certainly.
create support for them as well, yes.
Well, when I was at the University of Michigan, I took a master's in public health also, but I was always interested in your field and counseling and things like that too. I would have been, well, I have used it in the practice of medicine though. In all ways I have studied, not with degrees so much, but with life experiences. I think when you have life experiences, this is so important, even in medical school, that youngsters are chosen with a certain amount of life experiences rather than just, I want to be this or be that,
The other love that I have is that the churches,
yes,
a lot of them don't understand mental health per se, and I really would like to be able to educate and be able to go into the churches, doesn't matter the denomination, but
right.
actually educate them about mental health and inform them of the different services that are out there, like support groups and organizations
right.
that could be of great, tremendous help to the church community.
Have you ever thought of studying theology?
Actually, I have had to take 2 Bible classes for my mental health counseling because I'm going to a Christian college.
Oh, I see.
So I attend Naya College, so we've had to take theology classes as well. Yes.
Are you familiar with the New York Theological Seminary over there in Manhattan, right near the Rockefeller Church, the Riverside Church? There's a theological seminary.
Okay.
Yeah, I know some of the ministers there. I know you don't like to get around and travel maybe too much, but you certainly would be an adjunct professor to that kind of theology institution, So I'm going to try to see, just even if you're a guest speaker, I think it'd be good for them to see that also in the theology,
Sure.
Because that image that you brought up, I was with somebody just yesterday I had to visit who has multiple illnesses, and they wanted to pray. They just wanted me to come over and pray with them, and they had certain kind of tumors and things like this. And I was telling them the power of prayer and the power of these kind of things. And with you, how did you use prayer yourself in this whole bringing yourself up to a point where you became able to do what you're doing?
Well, I think part of prayer came in later when I became a Christian.
Oh,
that actually became part of my experience.
Right.
Where people wanted to pray for me. I'm sure that my parents and my friends and my sister had actually reached out to a lot of people that actually prayed for me while I was, while I was in the hospital recovering.
Yes.
But now it's part of my lifestyle as a Christian. I pray, and it's how I get the strength to do what I do every day and be able to put a smile on people's faces, and it's part of my life. Yeah.
Well, I tell you, your face lights up this whole television thing today, and coming here today to for one thing, and we decided we'd do this also. I think will play a major role in people who are looking at this show to get an impression that it's not the end when they think it's the end. It's the beginning.
Yes.
And you have traveled that road of the beginning of something happening, but a successful ending of many degrees, teaching, administration, and all the things that you've done. So it's just so good to have you.
Thank you.
Mr. Monty. And I hope that we'll have further, as you around here at Downstate Medical Center, they'll get a different impression upon you when they even, I don't know if you've ever been interviewed this way on television, but certainly this should be a part of the class teaching of knowing their teacher and what you're all about, you know. I have used prayer in my practice also in so many ways, and it's been remarkable recoveries I have seen, especially in my nephew who became injured that way, and went on to college, played basketball and everything else, and got married, and him and his wife live alone in a house that's full of that. So thanks again for being
You're
with us
welcome.
today.
You're welcome. Yes.
So for you folks out there, don't diss disability. You have a lot left inside of you. Spirit, prayer, all the things that can make a difference in your world.